Hey everyone, today we're diving into something that can be a hidden and honestly a really frustrating source of chronic pain and infertility for so many people, pelvic adhesions. We're going to break down what they are, how they're found, and explore a minimally invasive surgery that's offering real hope and relief.
So, let's start from the beginning. To really get this, we have to understand what it's like for someone who's actually experiencing this problem, often without even having a clear diagnosis to explain it all.
Just imagine for a second, you're dealing with this persistent, nagging pain, or maybe struggling with infertility, but every single test you take comes back completely normal. It's a tough situation, right? For a lot of people, that's their reality. The problem isn't some big, obvious thing on a scan. It's something way more subtle. And that's exactly where this story begins.
So what are we actually talking about here? Pelvic adhesions. The best way to think about them is like these internal, sticky spider webs made of scar tissue. Now, your organs are supposed to be able to move and glide around freely, right? Well, these sticky bands can actually tether them together, almost gluing them in place. This restricts their movement and can even pull them out of their natural position.
And the impact of these adhesions, wow, it can be huge. They can cause chronic pelvic pain because the organs are constantly being pulled and strained. They can be a major cause of infertility, maybe by blocking a fallopian tube or messing with an ovary's function. They can also make intercourse painful, or even lead to bowel and bladder issues if those organs get caught up in the mix. But here's the really tricky part. Sometimes a person can have them and feel nothing at all. They're completely asymptomatic and are only found by chance during a procedure for something else.
Okay, so we know what they can feel like, but what causes these things in the first place? And how do doctors actually track down this hidden foe?
You know, adhesions are basically the body's healing process that's just gone a little haywire. It all starts with some kind of tissue injury. This could be from a past surgery, a pelvic infection, or a condition like endometriosis. In response, your body lays down a sticky protein called fibrin. Think of it like a temporary patch. Now, normally, another process comes along and dissolves these fibrin bands once the healing is done. But if that second step fails for some reason, the fibrin just stays there and eventually hardens into permanent scar tissue. And boom, you have an adhesion. And you should know, not all adhesions are created equal. You've got what are called filmy adhesions. They're thin, see-through, almost like cellophane, and they're generally easier for a surgeon to deal with. Then you have dense adhesions. These guys are thick, opaque, and often even have their own blood supply. As you can imagine, they are much, much more difficult to treat. So how in the world do doctors find them? Well, imaging, like an ultrasound or an MRI, might give some clues, some hints that adhesions are there. An HSG test can show if the fallopian tubes are blocked, which is a big red flag. But because these adhesions are often so thin and web-like, the only way to truly know for sure, the gold standard, is for a surgeon to go in with a tiny camera and see them directly. That's called a diagnostic laparoscopy.
So once adhesions are confirmed to be the problem, what's the solution? Let's take a look at the main way this is treating.
The solution has a bit of a complicated name, laparoscopic adhesolysis. I know, it's a mouthful. But here's what it means. It's a minimally invasive surgery. A surgeon uses a tiny camera and very specialized tools, all through a few small incisions, to get a crystal clear, magnified view inside the pelvis. From there, they can go in and very precisely and carefully cut away those adhesions, freeing up the organs and trying to restore everything back to its normal, healthy states. And this slide really shows you why this approach is such a game changer. I mean, compare it to traditional open surgery, which needs a huge incision right down the abdomen. With laparoscopy, there's so much less trauma to the body. That means you're looking at a shorter recovery time and, this part is absolutely crucial, a lower risk of causing new adhesions to form, which can sometimes happen after a major open surgery.
So who is this surgery actually for? Well, a doctor will typically recommend it when adhesions are the prime suspect behind infertility. Or it's an option for chronic pelvic pain that just hasn't gotten better with anything else they've tried. It's also used when those adhesions are physically distorting organs and affecting how they work, or very specifically to treat adhesions caused by endometriosis.
All right, so if you're listening to this and thinking, hey, this might be something for me, you're probably wondering what the whole process is actually like. So let's walk through that journey from a patient's point of view.
The whole experience can really be broken down into 3 clear and simple phases. You've got the prep work before surgery, the actual surgical technique itself, and of course, all the care you get afterward to help you heal.
First up, preparation. And this part is so important.
It involved a really thorough checkup of your symptoms and history, a deep dive into any imaging you've had done, and, this is maybe the most important piece, a long conversation with your surgeon. You'll talk about the risks, the potential benefits, and what you can realistically expect. The goal is to make sure you are 100% informed and ready.
Then, during the operation itself, surgeons use incredible precision. They might use superfine scissors in what's called sharp dissection, or use special energy devices for tougher bands. For the really delicate adhesions, there's even a cool technique called hydrodissection, where they use jets of fluid to gently separate the tissues. And through it all, they're taking the utmost care to protect all the surrounding organs. Before they finish, they might even apply special gels or films, anti-adhesion barriers, to help stop them from coming back.
After the surgery, the focus shifts entirely to making your recovery as smooth as possible. That means good pain management and encouraging you to get up and walk around pretty early on, which is so important for healing. The team will keep a close eye out for any complications, and you'll have follow-up visits to see how you're doing, whether that's checking on pain relief or making a plan for fertility goals.
Okay, now for the big questions. Let's talk about the results. Does this work? What are the outcomes, and what are the things you really need to consider if you're thinking about this procedure?
Well, the numbers here show a lot of promise. Looking at the data, studies show that somewhere between 60 and 80% of patients see a real, significant improvement in their pain levels. And for those who are struggling with infertility, the improvement rates are between 30 and 60%. I mean, that can be absolutely life-changing.
Of course, like with any surgery, you have to be aware of the risks. There's a risk of bleeding, infection, or maybe injuring a nearby organ. There's also a small chance the surgeon might have to switch to an open surgery mid-procedure if things are just too complex. And here's the real ironic twist. The biggest risk is the body forming new adhesions as it heals from the surgery. That's why prevention is such a huge focus.
So, to fight that risk of them coming back, surgeons have a whole playbook of strategies. We're talking about incredibly gentle handling of tissues, being meticulous about stopping any bleeding, using as little heat from their tools as possible, and using those anti-adhesion barriers we mentioned. On top of that, treating the root cause, like endometriosis, is a massive part of long-term success.
So here's the crucial takeaway. A successful outcome here isn't just about the surgery itself. It's really a combination of three things: making sure you're the right patient for the procedure in the first place, the skill and expertise of your surgeon, and using all of those smart strategies to prevent the adhesions from coming back.
And that really leaves us with one final thought. For anyone out there living with the invisible burden of pelvic adhesions, a targeted, minimally invasive surgery like this is so much more than just a medical procedure. It could be the key to unlocking a future with less pain, with restored health, and with so many more possibilities.